So what's wrong with you? Why back?
I've actually been doing all my home exercises. I've been going to therapy every single day.
Doesn't matter. So I guess I'll have to make some more calls.
Okay.
Okay, and don't forget to pay a copay.
I think I did.
Okay, just make sure you pay a copay.
Sure.
I'll make some calls. See you.
Okay.
Hello,
Hi, can I please talk to some pharmacist?
this is she.
Hi, this is Dr. Olinek.
Oh, hi, doctor.
Hello. So I have a patient who came to my office and he complains of pain in his knee. So I just need to give him some narcotics so he doesn't come to my office.
Sure. It doesn't matter what kind. Any
Nah,
dose.
the stronger the better.
Okay.
Is really annoying.
Yeah, no problem.
Okay, what are you doing tonight?
Hello?
Hello, physical therapy?
Hey, what's going on, Vlad?
Not bad. I got a patient, I believe his name was Jim, maybe John. He came back and he said that his knee still hurts after the physical therapy. So what's up with him?
I don't know. I don't particularly care. Hey, what are you doing tonight? You want to go down to the S bar?
Yeah, the S bar is a good way to go, I think.
All right, I'll see you there.
See you, man. Bye.
All right.
Hello?
Dr. Olipnik?
Yeah.
Hey, I got your patient here. Is he okay for the MRI?
Yeah,
Hey, just walk in, I'll be right
Yo,
there.
dude,
Oh, yeah,
me and
just
Jim
walk
are going
in.
to the
Yeah,
bar.
yeah.
Are you coming as well?
Oh, yeah, I'll be there.
Local resident John Smith died today in an MRI-related accident, and it was really poor communication between his primary care doctor, Dr. Olenek, the physical therapist, the MRI technician, and others seem to be responsible for his death. And we spoke to Dr. Lucas on what should be done earlier today.
Come in.
Hi, Mr. Smith. How are you today?
Good. How are you?
I'm doing great. May I shake your hand?
Sure.
Great. So let me just first have you verify your name and full date of birth for me.
John Smith, April 20th, 1967.
Okay. So what brings you in today, Mr. Smith?
I've been going to PT for about 4 weeks now. Nothing's been working.
Right. Yeah. So I remember I gave you that PT referral.
Yeah.
So I also have here some of your notes from the physical therapist. And I think what we should talk about today is perhaps giving you a referral to the orthopedic surgeon. So the first thing I would like to do is I would like to speak to the pharmacist. One of the things I might be looking to do is to prescribe you some narcotic pain medications. So I will be calling her. I will be ordering an MRI to take a look at your knee. And I will be talking to the MRI technician about that. And then I will also be speaking with your physical therapist to find out exactly what you've been doing. Okay?
Okay.
So my main role today will be coordinating the care between you and all of these other specialists to make sure that you get the best care that you deserve.
CVS Pharmacy, how may I help you?
I am Dr. Lucas. I'm calling from Crystal Run Medical Center in reference to one of my patients, John Smith, date of birth 4/20/1967.
Yeah. I got this chart pulled up right here.
Okay, great. So he's been having some knee pain, and I've been considering prescribing him some narcotic painkillers. And I was wondering if I could have your advice on a couple of things.
Yeah, absolutely. I appreciate your call. Well, narcotics, first of all, I'm usually a little worried when it comes to narcotics. I usually like to make sure we check the dose, make sure it's adequate, and make sure we check any interactions with the medication as well. And I do prefer all of my patients to be in the iStop program, making sure that they're taken well care of and with the narcotics.
Right, we wouldn't want addiction to happen now, would we?
Yeah, I'm sure you know it happens more than you think.
Oh, I know. So do you see anything in his chart that would contraindicate them? Because I couldn't find anything.
Yeah, I was looking at this, and what caught my eye was actually the GI bleed, which initially I looked over it, but I saw that he was taking out some NSAID medications, and so I would just recommend that the patient would stop the NSAID medications given the GI bleed.
Oh, wow. You know, if it wasn't for a great communication, I could have missed that. So you know what? Thank you so much, and have a great day.
You too. Thank you very much.
Thank you.
Hello, Mountain View Physical Therapy.
Great. This is Dr. Lucas calling from Crystal Run Medical Center in reference to a patient that we've both been treating. His name is John Smith. His date of birth is 4/20/1967.
Oh, okay.
So Mr. Smith came into my office today, and I understand that you've been seeing him for the past 4 weeks?
Yes.
Okay, great. First off, I would really like to thank you for sending me those weekly progress reports. It has really, really helped me and really informed my care of Mr.
Yeah,
Smith.
definitely.
So I was just calling to touch base and get some advice about what you think his next step should be.
Yeah, well, I can advise you using SBAR, which stands for Situation, Background, Assessment, and Recommendation. So for our situation, we have a 49-year-old male complaining of knee pain. He's been seeing us for about 4 weeks, but treatment really isn't working, so I recommend maybe a follow-up appointment with you, possibly surgery.
Thank you so much for this open line of communication. And as I said, it really does help me care for Mr. Smith. Hello, Dr. Lucas speaking.
Hi, Dr. Lucas. It's Mr. Zhang calling from Mountain View Radiology. How are you doing?
I'm good. How are you, Mr. Zhang?
Great. I have your patient here, John Smith. I just want to confirm the date of birth. It's 4/20/1967. Is that correct?
Yes, that is correct.
Wonderful. So I do have your script here indicating that Mr. Smith needs an MRI of the left knee. Is that right?
Yes, that is correct.
Okay. My receptionist actually ran through a screening with him first while on the phone and also in person here. The patient denied any metal in his body or any PPIs or pacemakers. However, I just want to confirm with you because I do see in the patient report there is a bit of a cardio issue.
Yes, so medically he was cleared for the cardio issue. There should be no contraindications with the MRI. The one thing that I was a bit concerned about, however, was his military history. There is a potential for there to be some shrapnel in his body somewhere. He has said no, but it's something that I wanted you guys to be aware of.
Okay, great. I'll definitely take a note of that, and when I do screen the patient once again, I'll be sure to ask him about any shrapnel in the body.
Great, thank you.
I do see here on the report that you indicated possible need for contrast. I asked the radiologist here on staff. They don't think it's absolutely necessary. However, if it is, the contrast might be contraindicative with his GI bleed. So I just want to double check if you needed that.
Yeah, so I'm actually really glad you called. You know, based on what the radiologist said, I will go ahead and I will cancel that need for the contrast. So just an MRI with no contrast. And it's great that this level of open communication has been able to
After I
inform my
take the
care.
images and create the report, I'll have the radiologist take a look. And if they see anything remarkable, they'll definitely take a note of that. And once that's done, I'll fax it over to your front desk.
Okay, great. I do want to make sure I follow up on the MRI. So thank you so much.
Of course, anytime.
Okay, bye.
Bye-bye.
I never said goodbye. Maybe I never even said hello. Why did you have to go? Were you feeling sad? Wish I called to say it's not so bad.